Time we'll be starting immediately. So the first speaker will be Dr. Prithvi. He'll be talking about the basics of retinal laser, their delivery systems, the lens selection, and the parameters.
Good morning, everybody. So I'll be talking about basics of retinal lasers. Basically, what is laser? Light amplification stimulated emission radiation. This is basically laser coined by Gordon Gould. So what is happening here is there is a electron which gets stimulated, and when it emits the energy, there is a light particle which occurs, and this light particle, when it goes through a totally reflected a box-like thing which has mirrors which gets reflected and then comes out through one place, that is laser. So what are the properties of laser? It is monochromatic, it is coherent, collimation, polarized, and high intensity. So what are the classification of lasers that we have? We have solid state lasers, we have gas state, we have metal vapors, we have excimer, and we have diode laser. These are all the component of each of the lasers that are present right now. And over here you can see the various frequency and wavelength of particular laser, starting from 1064, that is ND-YAG infrared, 810 diode, 694 ruby, and we have frequency doubled 532 ND-YAG also. So all these lasers are different wavelengths which are used in our retinal lasers. So what are the modes of laser operation? One is the continuous wave, which delivers continuous stream of photons. The other one is a pulse laser, whereas energy pulses are produced of few tens of microseconds to milliseconds. Q switch, that is energy delivered via pulses of very short duration. A mode, fundamental system, and multimode are very rarely used. What are the laser tissue interactions? That is photodisruption, photocoagulation, photoablation, photochemical reaction, and photovaporization. These are the few laser tissue interaction which occurs. Photodisruption is Q switch ND-YAG. Photocoagulation occurs in argon, krypton, and frequency doubled. Photoablation in excimer laser, and photochemical argon fluid, and photovaporization with the carbon dioxide. So what is the mechanism of action? That is photodisruption. Laser light has an optical breakdown. Miniature lightning bolt occurs, and a vapor which causes acoustic shock waves and tissue damage. Photocoagulation, target tissue is there, which heat is generated and the protein denatures. Photoablation is a high in energy which required to break the chemical bonds that holds the tissue together, essentially vaporizing the tissue. In photochemical, there is a photosensitizer like a hematoporphyrin, which gets sensitized with the photon or a photosensitization, which gives high energy, triple stage, energy transferred, and the molecular like oxygen or free radical causes the cell damage or vascular damage or the immunology damage. Photovaporization, again, it causes carbon dioxide, which absorbed by the water of cells, and vaporization occurs, heat becomes cauterized, and cell disintegration makes it incision. And then the ionizing effect, that is Q6 NDR, causes ionization and plasma formation, absorption of the photons by the plasma, creating shock waves and tissue disruption. So what are the laser safety? That is class 1, 2, 3, and 4. No biological damage in the one. In the second, it is safe, and momentary viewing and chronic exposure can cause damage. Third is not so safe, even in momentary view, and more hazardous in the fourth. Laser delivery system, we have slit lamp delivery system, which is connected, the console is connected directly to the slit lamp, and you can use the slit lamp to focus the laser. Then we have indirect ophthalmoscopy. The console is directly connected to the indirect ophthalmoscopy, and we can use with the condensing lens. Then we have transscleral and endophotocoagulation. These are the various type of lenses that we have. Over here, special mention to Vogue area centralis that we can use for focal laser. And then we have a Mainster 160 or a Supracode 160, which you can use for the PRPs. Different lasers. There also Goldman 3 mirror can also be used if you have that. But Mainster PRP 165 you can use till the periphery. Then focal lens, again, Vogue area centralis and Mainster standard can be used for focal laser for the macula. So laser in retina can be used in multiple areas. That is for PDRs, retinal vascular diseases, clinical CSME focal lasers, choroidal neovascularization, CSR, PCVs, retinal breaks, symptomatic peripheral retinal lesions, retinochoroidal tumors. So what are the different types of grades? Grade 1, light bare blanching of RP. Grade 2 is mild hazy or faint white. Grade 3 is moderate or opaque dirty white. Grade 4 is heavy, dense, chalky white laser spots. So we'll go to the next thing. Prerequisites, consents, adequate dilation, topical anesthesia should be put, pain medication to be taken. Patient should be comfortable, clean the contact lens very clearly, put lubricants like viscoelastic or contact lenses because we have to keep it in the eye, and contact lens placement. So the assistant should wear a glass which can be protects his or her eyes from the lasers. So in laser photocoagulation, we can see the melanin absorbs the light and melanin absorbs light spectrum. Xanthophylls absorb blue light, and hemoglobin absorb the red is unabsorbed. Basically, yellow is absorbed. Laser in photocoagulation, continuous wave, that is green laser, frequency double, safe in macular diseases and krypton rated in macular conditions. I'll go directly to the PRP. Over here, you use a spot size of 200 microns, power 100 to 400 to get a grade 2, grade 3 burns. Duration 10 to 50 microseconds, and spot numbers are 1,000 per sitting for 3 sittings. So this is a case where PDR, you can see a very bad NVD, which you have to give good lasers. You can see over here the spot size and the interval should be good enough, and you can see complete regression of these NVDs. You can see over here the NVD is reduced very significantly, and this is not the end. You need to keep reviewing these patients. This is a RVO laser that was done. So you need to actually complete the whole area. Otherwise, you'll again see NVEs and NVDs coming. You can also combine your PRP with the FFA guide if you, to see the CNPs. Complications like vasovagal attack and decreased night vision, reduced contrast, all these can occur. Focal grid photocoagulation, you can see the spot size should be reduced to 50. Power also should reduce to 50. The duration should be less, and you need to grade 1 type of burn. Over here, you can see a focal laser that has been applied, and around 4 months, you can get the whole hard exudates also goes. Grid laser can be used for macular edema, and these are the complications. Barrage laser, again, retinal hole, you can barrage it completely so that it doesn't recur. There are subthreshold micropulse lasers. Just mentioning PDT with verteprofen, where you can use subfoveal classic CNVs, OHS, angiostreaks, CSR, PCVs, PDT parameters, and the TTT, just to mention because there is no time. Thank you.